ultrasound guided filler dissolve. Is it worth it? Yes, it's absolutely worth it. I'm Dr. Shaden, a board certified radiologist here at Luminous Medical Aesthetics in Woodland Hills. Okay, I admit I'm a bit biased as a radiologist. However, without a doubt, I think ultrasound guidance for filler dissolves is worth it. Filler can look like discrete pockets or become integrated into the tissues. With ultrasound, we can identify the small pockets of filler. As a radiologist, I was always taught to see the tip of my needle. In experienced hands, ultrasound is used for real-time guidance of the needle into the filler pocket for targeted dissolve. Otherwise, the status quo is to blindly inject the dissolving enzyme and rely on flooding the area or regional absorption, which is why there are patients that have had prior dissolve attempts, but without relief, until it's done with ultrasound guidance. Let's go over a couple of cases. Case 1. This is a patient that had filler placed along her jawline and chin. She had no problem with placement, but immediately afterwards she regretted her decision. She felt it made her already round face appear too full along the jaw and chin. Case 1. With ultrasound, we can easily find the filler along her jawline as the lobulated anechoic or black areas. In this case, the use of ultrasound is critical because it allows us to identify the nearby artery so we can strategically find the safest entry point for the needle to not only avoid blood vessels, but also to effectively inject the dissolving enzyme. Talking about identifying and targeting or avoiding something only millimeters in size in the face. If it was my face, I wouldn't want it to be done blindly. Case 2. This is a case of a patient that had a small amount of filler in the tip of her nose. She had no problems, it looked fine, but she just regretted having fillers and wanted it out. See this black anechoic area in the tip of her nose? It measures about 8 by 6 millimeters. With ultrasound, I watch my needle and the dissolving enzyme as it's injected into the filler pocket. We see the white dashes or bubble artifact from injection. 1 week follow-up post-dissolve, we see the filler is gone. Third case, the patient had a bump she'd noticed with certain faces along her smile line. She had filler placed in her nasolabial fold. Case 3. In this case, the filler was integrated into the tissues, which can make it a little harder to find. Ultrasound of the bump showed focal enlargement of the muscle on the right compared to the left. Here we can see the muscle on the left looks flat, whereas on the right it looks a little bigger and darker because there was a small amount of filler in the muscle. Using ultrasound, I targeted that specific part of the muscle and added dissolving enzyme. Post-dissolve, we see the muscle appears flat and less bulbous. Physically, the patient noticed improvement in the bump. Each person's filler journey varies. There are different reasons to get a dissolve, but in all cases, the use of ultrasound to find the filler and guide the targeted dissolve is always worth it. I'd like to end with a quote I hold dear by Maya Angelou. Do the best you can until you know better. Then when you know better, do better. We know better. Let's do better.